Welcome to all, this is Shakti. In my today's video, I'm going to talk about PCOD or PCOS, which is a very common hormonal imbalance disease nowadays, which happens through the bad lifestyle. Yes, if you don't sleep on time, don't eat on time, or probably you're too stressed in the life, then certainly you're prone to this disease. So what is the solution? Now if I talk about the solution, the yoga practice is completely 100% cure for this problem. Yes, I have many students who cured their problem with the yoga practice, but you have to be consistent in your practice. So in this video, I'm going to show you 15-20 minutes yoga practice, yoga sequence, where I'll be showing some yoga asanas and breathing exercises which you can practice every day at home. Along with the yoga practice, you need to make some lifestyle changes like your food, your sleep, your water intake. If you take care of these things, you will see the miracle in 2 to 3 months. So let's practice the sequence.
The first asana is Padahasta Asana. For this you will inhale, raise your arms up, exhale down, inhale, raise your arms up. Dynamically you are doing 20 to 40 rounds. Initially you start with 20 and slowly as you make a habit, you can increase up to 10, 20 more, and so total you will be doing 40 rounds at a time. Make sure you're breathing properly. When you're raising your arms up, you're inhaling, breathing in, and when you're bending down, touching the toes, you're exhaling. And relax by keeping your palms on the knees, by keeping your spine straight for a while. Keep holding nicely by touching your toes. You can try to reach up to the floor where you can put your full palm down and try to feel the stretch. Then you slowly come up with inhalation and relax by hanging your arms down and leg apart, relaxing, focusing on the breath completely. Getting ready for next asana, Utkatasana or sit-ups. For this, first you will inhale, raise your arms up to the shoulder level, exhale, sit. So if you have any knee pain, knee injury, you can bend half, or if you don't have any knee pain, your knees are completely healthy, you can sit fully down. And also you should not have a back pain. If you have a back pain, do half. Otherwise you can do full. If you don't have any kind of pain anywhere, you can just sit fully down and up with inhalation, exhale down, inhale up. This is how you are going to do 15 to 20 rounds. This increases the blood flow in your pelvic area nicely. Make sure you're inhaling and exhaling properly. And now you're going to sit down fully. And keep breathing normally while sitting down, and keep pressing your elbows on your knees so that your knees are getting a nice stretch from knees to the inner thighs. Try to keep your back straight in this pose and make sure you're breathing properly and normally. Try to sit in pose for 10 to 15 seconds initially, then you can increase slowly. Now we are into butterfly pose or Titili Asana, where you're going to hold your feet and you're flapping your knees slowly. Make sure your back is straight, spine is completely straight, and close your eyes and keep flapping your knees 25 to 50 times. Now you are going to take your feet little forward and you're going to raise your arms up. Inhale and exhale, drop them front. Inhale up, exhale side, any side you can choose. Inhale up, exhale other side. Inhale up. This is a very good specific asana for PCOD problem, polycystic ovaries problem. So you do it nicely, because this puts a full pressure on your pelvic area, and we are stimulating that part by doing these stretches. Make sure you're breathing properly, breathing out, down, breathing in, up and forward and side. Inhale up, exhale again side, and you will hold now each posture. Forward you're holding, putting your arms forward, breathing normal, head straight up, back is straight. Keep breathing normally. You can hold up to 10 to 15 seconds initially, then you can increase slowly. Now we are getting ready for another pose. For that you need to open your leg fully, come in the split. Now slowly you will raise one arm up and exhale on your toes, opposite arm to the opposite toe. If you're not reaching your toes initially, you can reach up to your knees, you can reach up to your thighs, you can reach up to your calf, wherever you're reaching. But make sure your back is straight, you're not hunching your back too much. And as you increase the numbers, try to go more closer to your knees. Keep doing more rounds. You can do 20 to 40 rounds. Make sure you're exhaling when you're bending forward, you're inhaling when you're coming up. This stretches nicely all the groins, the pelvic area muscles, nicely increasing the blood flow. Now you can just hold one by one each side, holding 10 to 15 counts, then coming up, then slowly other side. Drop your knee. If your knee is not dropping, just look straight, and then you slowly come up and drop your arms forward and slowly walk your fingers forward by keeping your back straight. Feel the nice stretch in your inner thighs, and then slowly, if you're more flexible, you can drop your elbows down on the floor. And if you feel you can go more further down, deeper in this pose, you can just spread your arm forward fully and touch your head down on the floor. Feel the stretch nicely in the inner thighs. This stretches whole pelvic area. Now slowly inhale and walk back your fingers and come back in the previous position. And slowly try to sit in this position for a few seconds to feel the further stretch. And then release. We'll go for Ustrasana or camel pose. First you can try half camel or the Ustrasana, pushing your hips forward. Then if you can do little more, then you can drop your one arm and other arm in the air. And then you can do the same other side, where you're dropping one arm on the heel, other arm in the air, pushing your hips forward, waist forward. And then you can drop slowly both the arms on your heels if possible. If you can't do this much initially, you can just do the half Ustrasana or camel pose, where you push your hips forward with the both hands on your waist. Then slowly relax in child pose, where you sit on your heels and spread your arms forward, head down. This is you can use as a counter pose after this pose which we did, Ustrasana or camel pose. Relax in this pose for a minute or so. Now we'll do a beautiful sequence of cobra to child pose, where we inhale, rise up in cobra, and exhale, sit in the child pose. We'll be repeating this sequence 10 to 15 times. Inhale up, exhale, sit in the child pose. Make sure you're breathing properly. Inhale up, exhale, sit in the child pose. Keep doing 10 to 15 rounds. Make sure your palms are at the one place, not moving. You're inhaling up, exhale, sitting. As I'm showing in the video, my palms are not moving at all. Now relax in the child pose nicely. Relaxation is very important after any posture. Now getting ready for another asana, which is Supta Vajrasana. For this you're sitting on your heel and dropping the elbows down on the floor. If you're a beginner or if you have any knee pain, just try this much. But if you have been practicing yoga with no pain in the body, then you can go further down deeper in this pose where you take your arms up nicely and feel the stretches. This is a very beautiful pose for the PCOD problem, which stretches your whole entire lower abdomen part nicely. You can hold this pose up to 15 to 20 seconds initially, and then slowly in the same way you will come back where you put the pressure on your one elbow and slowly you come up and sit properly. Now next asana is Janu Shirshasana or head to knee pose. For this you will spread your one leg and one leg is bent, and slowly take your arms up and exhale. Drop your arms, drop your palms on your toes. If it is not reaching your toes, then slowly keep it till the knees, wherever it is reaching comfortably without bending the knees. Now slowly try to take your head to the knee. If you are not able to do this much initially, you can keep your head up, look straight, and then slowly inhale, come up and exhale down. Now we'll do the next side, same, where you bend your other leg, keep it touching foot to the inner thighs of the leg which is straight, and dropping the palms, same way looking forward. And if you're flexible, you can go little down by keeping your chest little down and touching your head to the knee. If not possible, just look straight and try to feel the stretch. Initially you can do this much, then slowly you can try more forward and exhale down. Next asana is forward fold bend or Paschimottanasana. If you're not able to reach your toes, try to reach the knees or the below the knees, wherever your hands are reaching, but make sure your hands and the knees are straight. Slowly try to reach little more deeper down in this pose and hold for 5 to 10 seconds initially, and slowly inhale and exhale, drop your hands down. Now we'll practice Gomukha, or we call it cow face pose also. For this you will be sitting like this, and then your knee should be aligned in one line. Now you will take opposite hand of the leg which is up and try to catch it with the other hand from the down. You can see how it looks like from the back when you're holding the hands, and relax. Now the same way we'll do other side, and this time also your both knees should be in one line, and then you will take opposite hand of the knee which is up, and from down you will take other hand and try to catch the fingers as it is shown from the back. Practice Sarvangasana or shoulder stand, as name only showing the asana which nourishes all the organs in the body, and it is very good for the PCOD problem. Like this you will hold 30 to 40 seconds initially, then you can increase up to 1 minute. Then we are getting into Halasana. You can give the support from your back, and then after practicing many times you can release the support slowly, and you can practice without support also. Now again getting back to the Sarvangasana, and then we'll try some more dropping downs in the Halasana. Some more variation can be added. Where we put lotus in Sarvangasana, which is Padma Sarvangasana. It can be practiced with support and without support, and then slowly release. Now we'll practice the counter pose, which is Matsyasana or fish pose. For this, it can be practiced with the lotus pose, putting in the leg, or just keeping the leg straight also, where you put your palms under your thighs, chest lifted up, head down. Then slowly you can raise your arms up to feel the more stretch. And make sure you're closing the eyes in this pose and closing the mouth. And relaxing nicely with normal breath. Now next we'll practice Chakrasana or wheel pose. You can press your palm and lift your body up nicely, and you can hold. You can try some variations. If you have been practicing yoga, then you can try a few variations in the same, and then slowly release. And you can do the counter pose by hugging your knees. Keep relaxing in this pose for half a minute. And then we'll practice one more pose which is good for the PCOD, where like bridge pose or the Setu Bandhasan, you will be lifting your waist up with the inhalation and exhale down. Inhale, stretch your body up, exhale down. Like this you can repeat 10 to 15 times. Make sure you're breathing properly. And you can hold in the last round and relax. Now we'll be practicing another asana where you'll be dropping your both the knees together, right side, then slowly left side. Inhale, you'll be raising them up, exhale, dropping them down. This is a very good asana for any kind of back pain. Now slowly we start with Bhujangasana or Cobra pose. Press your palm, inhale up, exhale
Keep doing
down.
10 to 15 rounds.
Palms top of each other. Inhale, exhale down. Keep inhaling and exhale down while stretching up. Try to feel the stretch nicely in your whole stomach area, lower abs, middle abs, everywhere. Try to feel the nice and deep stretch. Keep repeating 10 to 15 rounds. Now next asana, we'll practice Shalvasana or locust pose. Keep your palms under your thighs and you're going to raise your right leg up, supported with the left foot on your right knee and your head resting on the chin. You can hold up to 10 to 15 seconds and then release slowly with exhalation. And now you'll do on other leg same way. This stretches nicely your whole lower abdomen part, which is very good for the PCOD problem. Now you will raise yourself in Cobra or Bhujangasana pose, and you will be sitting in the child pose or Shashankasana. You can relax up to 30 seconds to 1 minute in this pose. Now we'll be practicing Kapalabhati Pranayama or skull shining breath. For this, you need to exhale continuously by pulling your abdomen in. So basically you'll feel the strokes through your navel. And this pranayama works on your 72,000 nerves which is attached to your navel. This is a cleansing kriya which cleanses all the nerves nicely. Keep doing. You can initially start with 20 rounds and then slowly you can increase the numbers. You can do 3 to 4 rounds of 108
Kapalabhati Pranayama. Every day you can increase the 20 numbers in this pranayama, and you can reach up to 500 within a month if you practice every day. Now we'll practice cooling down breath by taking the tongue out, inhale, and slowly exhale. Basically, you're rolling the tongue in upward direction and inhaling through that. You can do 4 to 5 rounds of this cooling down breath. And after this breathing, we'll be practicing humming bee or Brahmari breath, which is a de-stressing breath. For this, you will be closing your eyes, keeping 3 fingers corner of your eyes, index finger on your forehead, thumb closing the ears tightly, and you're gonna inhale slowly through the nostrils, and while exhaling you're making a sound like a bee. So you're doing a hum like a bee. You can repeat 6 to 10 rounds of this breathing at a time. Initially, when you're as a beginner, when you're practicing, you can do 5 rounds. Then slowly you can increase every day. This is a very good pranayama for the insomnia, anxiety, depression. This can be practiced several times a day. And now just relax. You can lie down in Shavasana for 10 minutes or just relax like this for a while, focusing on the breath. Namaste everyone.